So I had a lift and augmentation this summer, and as I was trying to decide if I was going to do it or not, I was trying to like just learn more about it, find info online and like people's experiences and all of that. So I just thought I would share my personal experience. So if anyone is trying to decide if they want to do it or not, hopefully this will be helpful. But this is just my experience and not me telling anyone what they should do with their body. So why I decided to do this is because I was just not comfortable in my own skin. My body drastically changed sizes when I was nursing to not. So this is my girls before, it was fine. But then when I was postpartum and nursing, they got so big. Like, look how huge they are. And then when I stopped nursing, everything just shriveled away. I was left with just a lot of extra empty, like stretched out skin. I would have to tuck them into a bra. It was just super uncomfortable. Like having to fold things in half would just leave it like red and raw. And like if I was at the gym or beach, I was constantly worried that things were just gonna spill out because there was nothing to like hold in. It was just like empty skin, so it'd spill out really easy. So when I decided I did want to do it, then the next step was obviously picking a surgeon. So for me, there was 3 big things I was looking for. I wanted a surgeon that was a board certified plastic surgeon. That was huge to me. So along with that, I just wanted to make sure I had a surgeon that was really experienced, had done a lot of practice. So in addition to them being board certified, I also wanted someone that just had really good results. So I looked at hundreds and hundreds of before and after pictures, specifically looking for ones that looked like mine, because I just really wanted to make sure I could find a surgeon that could take what I had and turn it into what I wanted. Another thing that was important to me in finding a surgeon was location. I wanted to make sure that it was like a clean office and also in a location where it would be easy for me to get to and from appointments and just a nearby family, because I have 3 little kids and my parents were going to help me as I recovered. So I looked at tons of different surgeons, and then I ended up scheduling 3 different consultation appointments with 3 of the top plastic surgeons in Utah. And I ended up deciding to go with Dr. Rose at the Rose Clinic just because he checked all of the boxes. He was a board certified plastic surgeon. He had so much experience and just a great skill set. His before and afters were beautiful. I loved his approach and technique. His clinic is absolutely beautiful, and he has a surgical center right there in the office. It's super easy to get to. I also decided to go with Dr. Rose and the Rose Clinic because it was just like by far the best consultation appointment out of the bunch. I was so nervous going into it. I'm always like a little intimidated and just had like no idea what to expect, but they were so nice and it was such a great appointment. They were so thorough. They answered all of my questions and concerns, and they really took the time. They were just like genuinely excited, and that just meant a lot because I just knew that they really love helping people feel good about themselves. So they are great. I really can't say enough good things about them. As for what to expect at the consultation appointment, so a lot of plastic surgeons, especially the good ones, will have kind of a long wait list. So if it's something you're thinking about doing, I would say just like schedule an appointment and then you'll have time to think about it. But as for the consultation appointment, so before the appointment, I wrote down all of the questions and concerns that I had so that I could ask them at my appointment. So they were awesome. They went over everything. They went over the different types of implants. They went over Dr. Rose's procedure, how he does it. They talked to me about breast implant illness because that was like one of my biggest concerns and holdbacks with this. Another thing that I was like really worried about and that was like a deciding factor for me was that if getting this surgery done would affect my ability to live the active life that I do now and like do all the things that I do, then I wouldn't do it. But they were super great at explaining like how it would affect my chest muscles and like what I could and couldn't do after surgery. And pretty much I could literally do like everything I do now: rock climbing, surfing, running, weightlifting, all of that. So then after they go over all of that, answer all of your questions, then Dr. Rose came in and did a series of measurements. He just like measured all over, just like all over, and then took those measurements and gave me a range of sizes of like CC sizes of what would fit my body proportions the best, because I'm like a petite person, and so I definitely did not want something that would look unnatural or just like be too big for my body. I got to try those sizes on and pick the ones I liked the best. But after they did the sizes, then Dr. Rose sat down with me and went through his whole kind of like surgical plan. So at your consultation appointment, then you get your surgery date. So I went in 2 weeks before my surgery, had a pre-op appointment. I picked between like the 2 sizes I was torn between, tried them on again, decided on the one. Then they answered any last minute questions I had, and then I just signed the paperwork, just like the consents and everything. And then I left the pre-op appointment with a fun little goodie bag that had a whole bunch of supplements and vitamins to start taking in preparation for the surgery, just to help my body prepare for kind of the shock of surgery, and just to help with like inflammation and swelling and bruising and all of these things, which I loved that they did that, kind of just like these extra little steps to help get like the best recovery and results possible. They also gave me all of my pre and post-op instructions, so what I needed to do right before surgery and what I could expect after surgery. So then the 2 weeks before surgery, I just really tried to prepare my body for the surgery by just being super well hydrated, drinking tons of water, and then eating lots of vegetables. I really wanted to make sure I was getting a lot of greens in, so I did a lot of vegetables, and I also did greens, like drink mix-ins. So then the day before the surgery, they call you and give you your scheduled surgery time. Luckily, mine was first thing in the morning because you're not supposed to eat like 12, I believe it was 12 hours, 8 hours before surgery. Then right before surgery, you wash with this like special, I don't know, like hospital soap. It does not smell great. You have to wash with this like special soap. Then you go to your appointment. You want to wear like super comfortable, like loose fitting things that they can easily get onto you after surgery, preferably like something that like zips or buttons in the front, because you don't want to be like lifting your hands over your head. So I just got like a comfy like zip up sweat set. Before my surgery, I also made sure to just like prepare everything I could. I got all caught up on laundry. I made sure I had a good book to read while I was recovering. I stocked up on yummy snacks. So then when you show up for your surgery, they take a quick urine sample just to make sure you're not pregnant. And then they take your vitals, and then they get you all changed into like the beautiful hospital gown and like your little surgical bonnet and some like compression stockings. After the nurse gets you all ready for surgery, then the Dr. Rose came in and chatted with me and just went over any final questions I had, reviewed his surgical plan again, showed me what he was going to do. Then I met with the CNRA, who would be doing all my anesthesia, and he answered all my questions about that, told me what they would be using, what I could expect to feel like going under and coming out. And then I just walked down the hall to the OR. So the Rose Clinic has a beautiful office. It's so gorgeous, so nice, so clean. And they also have a surgical center right there in their clinic, which is so nice. So I just walked down the hall into the OR, and then I got some meds to do my IV, and they were just like chatting with me as we were going. And before I could even like answer the next question, I was out cold, don't remember anything, but apparently the surgery went great. So I picked what CC size I wanted, but it was more I picked what I wanted the final look to look like. So he had to remove a whole bunch of extra excess skin. So then that adjusted what CC he needed to put in to give me the same look that I had like tried on, if that makes sense. And he did great, nailed the size. So I did also get a little bit of fat grafting because I have a sunken sternum. He did a fat graft and pulled some fat from my upper thighs, like did a little lipo, and then did a fat transfer to like fill in there and just like fill in my cleavage to give me like a really natural soft look. And that was another reason I actually wanted to go with Dr. Rose, because he was the only surgeon that proposed that. And I actually never even realized that they could do anything for my sunken sternum. I just thought that's just the way it was. And that always just like made my cleavage looked more deflated, but I really loved how detail oriented he was and knew how much of an impact that would have for my like final look and results. Like it really made it look so much better. So then coming out of surgery, I woke up obviously feeling super groggy, and it was pretty uncomfortable and painful first waking up. Like I felt pretty crummy, felt so sore on my chest, but my upper thighs where they did the fat grafting actually hurt the most. They were just like, I don't even know how to describe it. Burning, but also like super sore. Like you have the worst bruise of your life and someone's like punching it, but then also burning at the same time. Like it was really uncomfortable. I didn't realize how painful the like whole liposuction could be, but it makes sense. Like if you like know what they do or like have seen them like doing it, like digging for fat, like totally makes sense. They gave me some pain meds, and then they went over recovery and like post-op instructions. My mom was there with me because I was so out of it. So they went over all those instructions with her and then got me ready to go home. I had my surgery in the morning. It was a 3-hour surgery, and then I went home and pretty much slept the whole day. So recovery, the first day was painful, but I pretty much slept all through it. I would just like take pain meds, go back to bed. The next day was uncomfortable and like a little painful as well. I would say when I was on the pain meds, it was totally manageable. The next day was better. It was still like a little painful, but with the pain meds, I would definitely say more just like on the uncomfortable end. So I just took pain meds. I got up and was trying to walk around a little bit more. but definitely like hung in bed a lot, watched TV, read books, did some work on my phone, things like that. The third day, I just did like the heavy pain meds at night when I was going to bed, and then just like ibuprofen and Tylenol during the day. I got up and was walking around a lot more. I'd like go sit and play with my kids for a little bit, but I was definitely very tired. I'm normally not a person that can like nap during the day, and I was like napping a lot just because my body was tired from like healing itself. I was also taking all the supplements and like vitamins that the Rose Clinic gave me just to like help speed up the healing process and recovery. And then after day 4, I wasn't on like any pain med. It felt really good. It just felt like chest pressure and like soreness, tightness, and then my legs just felt like a little numb and tingly. They didn't hurt anymore, but they were still kind of numb and tingly. And also with recovery, you have to wear these compression stockings and shorts, and then you have a post-op surgical bra that you wear, and then over the bra it's just like this giant stretchy piece of elastic that you wear just to like push the implants down. And honestly, that was like the most uncomfortable part, and I felt like I was kind of maybe like arching my back with it, so it just made my back like sore. You can take it off to shower, and that always just feels so good because you're like, oh, I'm free. But overall recovery was honestly not bad at all. I've never had surgery before, so I can't compare it to another surgery, but I have had 3 babies. 2 of them were unmedicated, and yeah, I thought baby recovery was way worse. The hardest part for me was just like not being able to do anything, like no heavy lifting for the first few weeks, nothing heavier than I think they said like 5 pounds. So I couldn't carry my kids. Luckily they are able to like climb into their car seats on their own, and I can just buckle them. But like if I went grocery shopping, I had to like do it on a time when my husband was home and could carry all the groceries in. Or like with laundry, I couldn't carry the laundry upstairs. I had to have my husband do that. So it is super nice to have someone there the first, I'd say like 2 days as you're recovering to help you like stay on top of your meds and just help you with anything you may need. Like I didn't realize I couldn't open my pill bottles. So it's just like nice to have someone around the first like few days for those things that you like don't realize are hard doing. But then like after a week, you're able to pretty much resume like normal daily activities. If you were working a desk job, you could go back to work. It's really just like the lifting. For the first 2 weeks, they don't want you to get your heart rate up at all, just because it can cause like all the little blood vessels to rupture, but they do want you like up and walking around just to make sure you don't get like a blood clot. After 2 weeks, you're able to start doing like a little bit more activity, but no like high impact activity. So I was able to start doing like the stair climber or just like walking on the treadmill, things like that. And then after like 6 weeks, I could start like running again, just with a really high impact sports bra. So after like the 6 weeks, I could pretty much do most things except for chest specific exercises. Then at 3 months post-op is when you are considered fully healed, and that's when you can go back to doing anything. I had incisions around the nipple and then straight down. They call it the lollipop incision. And then after about a month, all of the steri strips that were on the incision sites came off, and I started using this special serum that they gave me that just helps with the scarring. So I'll just keep using this until it's gone. The scars will take about a year to fully heal. It is super important to keep the scars out of the sun while they're healing, which obviously it's on my boobs, so that's easy to do. And that is pretty much the whole process, start to finish. I am so happy with my results. Dr. Rose and the Rose Clinic did such an amazing job. It was so worth it.